A program that helps people living with HIV and AIDS is getting more funding. That means that more people will be able to get the services they need through the Ryan White program. Bridget Harris is the Assistant Director of the Ryan White program. Welcome to Fulton today.
Hi, Shania. Thanks for having me.
So first things first, talk to us about the overall needs of your clients through the Ryan White program.
The Ryan White program is designed to improve the health outcomes of persons that are living with HIV disease. Our overall goal is to get these persons into care, to have viral suppression, as well as to reduce the risk of the disease transmission. In addition to that, a lot of our clients, at least 70% of them, do not qualify for enrollment in the Affordable Care Act marketplace, also known as Obamacare. So we have additional concerns from our clients in the areas of transportation, mental health challenges, as well as substance abuse issues that need to be addressed before persons can actually address all that is needed and required for the treatment and care of HIV disease. We also struggle with the fact that due to Georgia not participating in Medicaid expansion, it creates a huge need for services that the Ryan White program provides.
And now tell us about the funding increase.
We are excited with the Ryan White program because this year we received an additional $1.4 million from HRSA, which stands for the Human Resources and Services Administration. So this year we have a total award amount of $23.7 million to serve persons for treatment and care for HIV disease.
And Bridget, how will these funds likely be used?
We are required by our funder to provide core medical services as well as supportive services. Some of these categories consist of providing primary care, medical case management, substance abuse, as well as mental health services. We realize also that in order for persons to receive treatment and care, that there may be barriers that would prevent them from doing so. So our supportive services are in the areas of transportation. We also provide child care services, legal assistance, as well as food delivered meals. In addition to that, we have a very unique aspect to the Ryan White program, and that is a planning council, which helps us every year to determine the funding priorities for the categories that I mentioned. So we'll find out specifically what those priorities are later this month.
And your final thoughts?
Each year, through the Ryan White program, we are able to serve 13,000 persons that are living with HIV disease. And because there are an increase in reported cases of HIV, we received additional funding through Fulton County. So what we'd like for people to do is, if you're HIV negative, we want you to get tested. We want you to know your status. And if you're HIV positive, we would like for you to get in care, enroll in our programs, take your medications so that you can have viral suppression, and also prevent the spread of HIV disease. Help us help you to improve your health and the overall outcomes of the community.
Bridget Harris, Assistant Director with the Ryan White program. Great information. Congratulations. Thank you for your time.
Thanks again for having me.
Now, for more information on the Ryan White program and their services, you can call their office at 404-612-8285.